you'll have a recurrence. Definitely. Anyway, simple case first. What do we have here? We talk about orbit. Where's the ophthalmic artery? Huh? There's no ophthalmic artery, right? Hmm? Yeah, I'll give you the pointer.
This one? What is this one? I'm not sure.
That's probably, the orbitofrontal branch of the anterior cerebral artery. Okay? This, you see the orbit? This is starting from here, right? Orbit is inside. Right? Forget about this coils. Right? So, is she blind? Is he or she blind? Yeah. Can you give her a microphone? Okay.
I think I would do either check the CCA run or do an ECA run and see.
What? CCA?
So check either the CCA run,
Common carotid.
common carotid, sorry,
What?
or ECA run, and see if you could see a when you go up that.
There you go. You can call this the very various names. But so the ophthalmic artery could be. You said meningeal.
Yeah,
right?
meningeal.
Meningeal artery, right? That is what? Remnant of what? We talk about all day.
Stapedial system.
Stapedial system, right. Stapedial system. Good. What do you want to see next?
I want to see the ECA,
Okay.
external carotid artery.
Okay. Now what do you see? Do you see ophthalmic artery now? Yes, you see the ophthalmic artery. This is feeding through middle meningeal artery. Okay. This ophthalmic artery going through where? Which hole?
Superior orbital fissure.
Superior orbital fissure. Foramen huddle is lacrimal branch going through. Okay? You have to remember lacrimal and recurrent meningeal artery is different. Okay? So this go through superior orbital fissure and supply whole content of the orbit, this case. Okay? Another case. It's probably tiny bit of collaterals, but okay. This case, what do we have? What do you see?
It's a low loading ophthalmic, dorsal ophthalmic.
Yeah, ophthalmic artery is originating from caverous angle. This is dorsal ophthalmic and going into orbit through superior orbital fissure. Very good. Okay? And you can see tiny little branch. And actually, I showed the case during my talk. Yes, it could be dual supply to the orbit, right? And this is a dorsal ophthalmic, and this is true ophthalmic. It goes through where? Optic canal. Very good. Okay? So this is the one that goes through the optic canal. This is going through superior orbital fissure, right? Okay, this is the diagram I showed you before, right? This is another case of dual. You see the dorsal ophthalmic and tiny little ophthalmic artery goes through. You have to not be confused with this, the artery which goes to the gyrus rectus muscle. I mean the gyrus rectus, not muscle. Okay? Orbit, okay? Branch which in the lower down, okay, in lateral view, cribriform plate is lower than orbital roof. You understand what I'm saying? Okay? So don't be confused with this orbital frontal branch versus this the ophthalmic artery. This I showed you, double, right? This is a gain, right? No ophthalmic is coming from middle meningeal artery through the recurrent meningeal, okay? And go through the superior orbital fissure, okay? Again. Okay? Now, what do we have here? This is common carotid artery injection. You are from Toronto, you should know this. This is common carotid artery injection. Where is the internal carotid artery? This is going up, ends in the ophthalmic artery, right? This is this. We went through 7 different segment agenesis, right? Which one was the one ends up in the ophthalmic artery? 7. 6 is no internal carotid artery, right? 6 is no internal carotid artery. Okay? 5? 4 is a retina. The 5 is it? 5, yes. Okay? So remember, in case ophthalmic artery ends up, the internal carotid artery ends up in ophthalmic, it's 7th segment agenesis. Okay? The 6th segment agenesis, there's no internal carotid artery at all. Ophthalmic artery is filling through posterior communicating artery, reconstituting internal carotid artery and ophthalmic artery, or internal maxillary artery collateral to the portion of cavernous segment of the internal carotid artery and giving ophthalmic artery supply. Right? Okay. Any questions about that?